Welcome to the European COVID-19 Drugs Calculation Tool, a tool designed to generate an estimation of the drug need to assist patients during the COVID-19 pandemic over a variable time frame, up to 1 year. In this tutorial, we'll go over the main features of the tool, as well as how to better customize its parameters to obtain a more accurate estimation. Before using ACDCT, always make sure to click on the Enable Editing button. As this tool utilizes VBR macros to run properly, please make sure to enable them either by clicking on the appropriate button or by following this procedure. For more information on macros and their activation, you can check the Microsoft support page linked in the document. We are now finally ready to start using the tool. If you'd like, a brief guide on how to use the ACDCT is available by clicking on the How to Use button. The estimation can be carried out using two different approaches, which can be selected by a drop-down menu in the green cell of the current page. The first approach allows you to fill in a pre-made input form in which it's possible to provide all the relevant epidemiological data and all the data concerning your local health facility capacity in order to perform an automated forecast of the epidemiological curve, which will be used to estimate the drug need. The other method allows you to manually input the weekly numbers of hospitalized patients, from which the drug need will be directly extrapolated. Once the estimation method is selected, an hyperlink connecting to the appropriate page in the tool will appear. Hyperlinks were in fact designed all throughout the document to allow the guided path between the different sections of the tool. Let's start by performing the estimation via the input form. This method, as previously mentioned, forecasts the epidemiological curve by using an SIR model. For more information on the model and its implementation, please check the ACDCT PDF guide. All the editable fields of the form are marked in orange. Some of those fields are mandatory, and appropriate error messages for each section will appear if left empty or not properly filled in. Until all the errors are fixed, you will not be allowed to browse the next section of the tool. The first section of this form is about the population selection. From a drop-down menu, you can select manually, which allows you to directly fill in the number of people considered, which can be particularly helpful to perform an estimation on a specific region. You can also select by country, where you'll be able to choose the total population of a specific country, whose data was extrapolated from the World Bank. The next step is the R0 calculation. This can be achieved by manually inserting the value or by providing values for each epidemiological parameters, such as the number of contacts, which is the average daily number of human contacts per person, the probability of infection, that is the probability of being infected as a result of a contact, and the infectious period, which is the number of days during which an infected person can still infect others. The form allows you to choose between default values for the parameters or to manually insert your own. You're always encouraged to update these values using the latest data available. Then you must fill in the initial situation section of the form. In order to make an estimation based on the current epidemiological situation, you must enter the total number of cases to date. That consists of the cumulative number of cases from the beginning of the pandemic to the date of the start of the analysis. The latter is automatically updated by the tool and always set on the current date. Additionally, you must insert the active cases to date, which consist of the number of the currently infected people. The hospitalized patients to date, that is the total number of patients that are currently hospitalized, and to the new cases, which is the number of new infected registered today. Please note the date inserted should only be considered for demonstration purposes. Finally, there's the date of the first case, which is the date when the first case was registered. If you're dealing with an entirely new outbreak, whose start date is the same date of the analysis, just leave this field empty. Once this field is compiled, the form will ask for additional data, specifically the total number of cases and the number of active cases. These are the same as the one discussed before, but refers to a date at most 14 days prior to the one of the analysis. This data is necessary to properly estimate during the early stages of the infection some SIR values that depend on the past epidemiological situation. You can choose the methodology used to distribute the cases during the window of time considered, either linearly or exponentially. For more information on these two approaches, you can click the Info button. If you're using the Select by Country option in the Population section, an hyperlink connection to the Johns Hopkins University data repository will appear. This repository contains links to the epidemiological data for each country, shared by official sources. The following section deals with the non-pharmaceutical interventions, or NPIs. These are a wide array of strategies, not including vaccinations and drugs, that aim to minimize the virus spread, as they reduce the RT value. They can be summarized in three different categories: closure of activities, the use of face masks, and the sheltering in place of the population. Please note that this section is not mandatory, as it depends on the strategies adopted by your local government. Please select Yes on the drop-down menu in the appropriate cell if you'd like to implement the NPIs. The three categories will then appear. In the type of closure field, it is possible to choose between different preset clusters of activities, increasingly more restrictive. Only big events and entertainments, big events, entertainments and non-essential retail, big events, entertainments, non-essential retail and schools and universities, and all activities, including essential. For each of the categories, you should specify the percentage of adherence to the NPI implementation, which should be carefully assigned by assessing the real situation observed in your area. In fact, even if these NPIs are mandatory by law, the compliance is likely to be 100%. For example, according to some models, during the Wuhan lockdown, the estimated adherence to the sheltering in place was around 92%, and it was even lower during the European lockdown. If you'd like to further edit the NPI parameters, it is possible to browse on the NPI page through a hyperlink. Here, it is possible to specify the adherence to the closure to every specific activity. You can also find a table containing more advanced editable NPI parameters, whose values are calculated based on the COVID Act Now model, and are more exhaustively described in the ACDCT PDF guide. In particular, we'd like to stress the importance of these following parameters: the minimum period of NPI implementation and the lag time before the NPI impact on RT. The former is the minimum time that the NPI must be implemented to be effective. A reasonable suggested value ranges between 30 and 60 days, and it's set by default to 60 days. The latter is the period between the NPI implementation and its full effect on the RT value. In fact, since the clinical course of the COVID-19 infection lasts on average 14 days, considering the incubation, the contagious and convalescent period, it is clear that the effect of the NPI measures adopted will be observed with a certain degree of delay. During this lag time, there will be a stepwise reduction of the RT value until it reaches the minimum value on the final day of the lag time. As per usual, further information regarding the RT calculation during the lag time is present on the ACDCT PDF guide. In any case, the suggested value for the lag time is between 2 to 3 weeks, and is set by default to 21 days. The resulting RT value obtained after the full implementation of the NPIs is shown on the highlighted cell. As for the date of implementation, you must fill in the dates in which the NPI will be first implemented, and the expected date of interruption, up to 1 year, which is the maximum time window considered by our forecasting tool. If the NPIs are already implemented, you should insert the current date as the date of implementation. A new box will appear where you'll be asked if the NPIs are already active. If the answer is yes, then the tool will not consider any lag time before the full effect of the NPIs on the RT value is observed. In any case, we suggest to perform a new analysis anytime a new NPI is implemented. The last section is about hospital bed capacity. Here, you must provide the number of hospital beds available, which is the total hospital beds, the non-ICU beds, and the ICU beds. More in detail, if the population section is set to by country, then it is possible to choose between the default value of hospital beds, inferred for each country based on the average number of beds adjusted by the country income group. Otherwise, you can simply manually insert the number of beds. However, if the epidemiological estimation is performed using a manually entered number of people, you can choose between two options. Insert hospital beds for the total area considered, and insert hospital beds for a percentage of the total area considered. In particular, the latter allows to specify a percentage of the total infected population that will occur in a catchment area. This may be useful for single hospitals that are likely to assist only a percentage of all the patients who will need hospitalization within the area considered. If you'd like to begin a completely new data entry, you can use the Clean Form button to erase all the fields. If you'd like to edit more advanced epidemiological parameters, please click on the appropriate button. The first editable parameters are the one used to calculate the default value of R0 as previously described in the input form section of this guide. The values assigned in this set will be automatically used as the default values in the input form. Then there is the first usable date for the pandemic start, which is the earliest date that can be used as the date of the first case. The default value is set to the 1st of January 2020. As for the hospitalization length of stay, this is where you can modify the length of hospitalization stay predicted, according to the different critical care, which is length of stay of the non-ICU patients, ICU patients, and the length of stay in ICU. Regarding the clinical features of COVID patients section, here you can modify the predicted percentage of patients that will be ventilated, intubated, and in shock, the average number of days until hospitalization, and the percentage of patients that will have a mild to moderate severity of symptom. The other additional fields, hospitalization rate and percentage of hospitalized in ICU, are not directly editable and are calculated instead by age-weighting the population considered. These fields can be modified from the age-weighted parameters page that can be reached through this hyperlink. If you chose in the input form a population selection by country, the data will be automatically age-weighted to consider the distribution by age group according to the income group of the country considered. On the other hand, if the population selected was manually inserted, then the default values considered are the European percentage of population for each age group. In any case, should you prefer to, you can manually edit them. As for the values regarding the percentage of cases requiring hospitalization and the percentage of patients requiring critical care, they are set according to a report by the Imperial College, but are also editable. The last section is the rate of documented cases by testing, where you can edit the percentage of patients with a mild to moderate severity of symptoms that are detected by testing. According to scientific evidence, the percentage of undocumented infections at the beginning of the pandemic ranged between 82 to 90%, and the detected cases ranged between 10 to 18%. Considering that the patients with severe critical symptoms are the least likely to be undetected, we decided to consider the percentage of undocumented infection as relating exclusively to the patients with mild to moderate symptoms. In any case, you can find all of this information by clicking on the appropriate icon. Please note that since the early stages of the pandemic, the testing capacity of each country has progressively increased, so we encourage you to update the default value according to the latest testing capacity data. Additionally, please consider that as the testing capacity increases, the hospitalization rate is likely to decrease. Therefore, when you modify this value, you should also modify the hospitalization probability for each age group in the age-weighted parameters page. Once all the necessary data is properly compiled, an hyperlink to the summary dashboard will appear. This page provides an overview of the epidemiological distribution forecasted according to the data entered. More in detail, you can find some data and charts relating to the evolution of the epidemiological situation over time. Additionally, you will find some charts representing the total hospital bed demand, the non-ICU bed demand, and the ICU bed demand. Please note that the threshold line represents the maximum number of beds available. Finally, it is possible to go back to some of the previously described pages through these hyperlinks, or to go forward to the drugs list section through this hyperlink. In this section, you can consult the quantity of drugs needed to treat hospitalized patients during the time frame considered. This page summarizes data related both to the patient and the drugs, such as therapeutic group, active principle, commercial dosage, that is the dosage available in the market, pharmaceutical form, total dosage for the patient considered, and total number of commercially needed doses for the patients considered. You can also find some general therapeutic indications for non-critical patients, as no consistent guidelines for these cases exist yet at the time of this recording. In particular, the use of drugs such as remdesivir or dexamethasone that show some degrees of efficacy mainly depend on the patient's need for oxygen supplements. Finally, you can easily browse through different time frames by using the timeline tool. This allows you to directly select ranges of days, months, quarters, or years through the use of a specific button. Once a new time window is selected, all the data about the amount of drugs needed will automatically update. In any case, the information about the drugs can be edited in the therapy setting page, reachable through an appropriate hyperlink. Please note that the printing layout has been optimized for the ICU drugs list. If you'd like to modify the layout, please do so manually. The therapy setting page contains the drugs database. As per usual, all editable data is marked with the use of orange cells. In particular, for the active principle column, the only modifiable cells contain a drop-down menu in which it is possible to select interchangeable alternatives. We have then the daily dose, that is the average daily dose of a particular drug, and the dosage available in the market, which is the commercial dosage considered to estimate the amount of drugs unit doses needed. The following two columns are related to the estimated percentage of ICU patients that require a specific therapeutic group or an active principle within that group, whose data was informed by scientific literature. Finally, the last editable column is the average treatment length, that is the average duration of a specific therapy. The non-editable fields from the daily dose, the dosage available in the market, and average treatment length column can be modified by browsing the drugs parameter page, which will be fully explained later in this guide. The last three columns are used to calculate the total amount of unit doses for the number of patients considered by multiplying the daily dose by the percentage of the ICU uptake by therapeutic group and active principle, and the average treatment length, divided by the commercial dosage considered. For further information about the calculation method, please check the PDF guide or click on the appropriate icon. If you'd like to add a new item to the list, simply start filling in the table from the first available row. Please note that when adding a new item, you are also required to specify the pharmaceutical form through a drop-down menu. All the information inserted in this section will be automatically updated in the drug list page. Finally, in the drugs parameter page, it is possible to finally choose some parameters about interchangeable drugs, the average length of treatment for drugs used with the same therapeutic indication, or some dosage available in the market. The second approach available to estimate the drug needs is, as previously mentioned, the manual data entry, selectable from the Stats page drop-down menu. By following the hyperlink, you'll be directed to a table where you can manually enter data about the weekly number of hospitalized patients from the date of analysis to 1 year in the future. This page is designed to enter data based on a previous pandemic surge or calculated with an external mathematical model. This way, the ACDCT will be exclusively used to estimate the quantity of drugs needed. The fields that must be filled in are the total hospitalized patient and the hospitalized ICU, while all the other fields will be automatically computed. Please note that all the editable cells have validation criteria aimed at guaranteeing a correct and exhaustive data entry and will warn you of any mistake made during the data compiling. Considering that no information about the epidemiological parameter is provided in this approach, no summary dashboard will be generated. Instead, as soon as an entire row is completed, an hyperlink connected to the drug list page will appear. Please note that the drug list page is essentially identical as the one with the input form approach, with the only exception being that the smallest temporal unit is not days but weeks, due to the fact that the data was provided on a weekly basis. All other further sections about drug settings and parameters are the same as previously described in this guide. If you'd like to start a new data entry, it is possible to clean the form with a specific button. Throughout the tool, you will find hyperlinks to the references used to set the default values or to support the base assumptions made. By clicking on any of them, you will reach the reference page, where you find external links to the actual documents or web pages referenced. To go back to the previous page, simply click on the corresponding link on the Go Back to the Corresponding Section column.